Hi, I'm Brad Power, and this is the formal part of our weekly update. I think this is number 7, possibly. Could it be that many already?
Yeah.
And as usual, we will first have Linnea give us an update on the data gathering that she's been involved in and sort of the state of play there. And then we will have, that'll be about 10 or 15 minutes, and then we'll have a roundtable discussion on topics like we were just picking up, which was how widely to draw the circle around a targeted therapy, as Will Valley was educating us about whether it's metformin or other sorts of things that one might do that would complement and enhance whatever the target is that's going in that with that drug. And Linnea is saying that her bias is to be as wide open as possible to a holistic view, an integrated view. So Linnea, maybe you could kick us off with what's new.
Not a whole lot. This is kind of a dull week, but next week, next Friday, I should have a lot to talk about because I have my upcoming scan on Sunday, and I have appointments next Thursday with both Dr. Lin and Dr. Shaw. And we'll, of course, be discussing the scan, but I will also be engaging both of them per the request for a biopsy.
Cool. And just to update on 2 additional things, Grace, I see Grace Cordovano's on, and she's been very generous and made that connection to Somologic and the proteomic testing. Where do we stand in terms of giving them what they need in terms of a kind of an agreement so that we can get that testing done? I don't know where that's.
Sure.
Yeah, thank you.
Hi, everyone. Thanks, Brad. There was the question of the form for the IRB for sharing results. So we still have not resolved that. I'm happy to follow up on that with you offline. Great.
And then Linnea with Natera agreed to do their blood biopsy. And I think you have an administrator to work with to get that all lined up.
Oh, okay. Yeah, I dropped the ball on that one. So
yeah,
I will.
Well, since you're going to be going into clinic, maybe you can get a blood
Yes.
draw, just coordinate that next week, and we can get. I'm very curious to see if the Natera, blood biopsy will come up with something different than the 2 blood biopsies we've already had. And so if they're confirming or something different, the 2 for everyone here, with the 2 that we've had have been from Lucence and Foundation Medicine, have come up with different identified variants. So it'll be interesting to see if we get, like I said, if we get confirmation or something different there. And Linnea, you said you went to Mercy Bio yesterday, so maybe you could give us a quick update what you learned there, because that's also a blood biopsy test as well, isn't it?
It is, and it's where did I put my notes? I don't know if I can describe the technology very well, but it's looking for a different signal, and it is focusing on early detection, and their proof of concept has been with ovarian cancer, but they're looking to expand into lung cancer next. So I went and listened to a presentation and just spoke to them about my situation. And I'm just happy to have that connection, because even though it's not something that applies directly to my case right now, they offered to help in any way they could. So.
Yeah, I find it interesting with these blood biopsies that they could be screening, so they could be early identification, but then they can also be monitoring depending on what use they want to put the blood biopsy to. So to the extent that, if we could, again, it's all, more data is better, more analysis is better. So if they were willing to apply their test to you, that would be a great thing to.
Yeah, I'm going to grab a note I made yesterday so I can tell you more specifically what they do.
I looked at their website, and it's something about, again, particles in the blood and using those as indications of cancer elsewhere in the body.
Is it extracellular vesicles? by chance?
Yes.
Yes,
Vesicles,
yes.
that's the word. Good job, Kimmery.
Good job.
Vesicle, that's the word.
EVs for short, EVs.
Yeah, I had to write that down. I couldn't remember it. But it was very interesting to hear it described where there's, what did they say? There's less signal to noise, or maybe I have that backwards, but it is a different concept. So,
Good. Well, again, more tests are better. It's good for them, I think, too, because we have 3 other blood biopsies potentially to compare them to. So for them, it's a good, you're a good test case.
I offered to give them as much blood as they want. And it's such an interesting company because the co-founder is this wonder kind who is doing his PhD and MD at Harvard right now, and also a co-founder of Mercy. And he's the one who came up with the concept.
Cool.
Yep.
I was asking, what is the name of the company? I didn't catch it.
Mercy Bio. So it's Mercy Bioanalytics.
Okay. There are some other EV platforms out there that could be a little bit more mature.
Yeah, they're still early stages.
I'll try to find out.
Thanks, Kimmery.
Yes.
One other thing in the formal part before we open it up. So my intention in the open forum today, in addition to whatever anyone else wants to talk about, is to arm Linnea with the arguments that she will use when she goes in to talk to her oncologist on Thursday. What are the arguments for getting that biopsy? And Kimmery, you were good last time, and sort of positioning that they might be concerned or conservative about taking the risk of doing a biopsy. So it's a balancing act. And so what would be the arguments in favor, and to make sure we're as clear as possible about what those might be. But I noticed Gail Thornton is on here, and one other topic, Gail, we've been talking about a bit of publicity, and the conversation we had last time about tissue as the issue, which is also related, of course, to this biopsy. Gail felt that was something that would warrant an article potentially, and the folks at Citizen, there's a woman named Devin who is their former FDA, I think, is their expert on what are patient rights and this whole notion of consenting and the concerns Linnea has, like, wait a minute, they took a piece of my body and I don't get to use it? What's the deal? That whole thing. So Gail, maybe you could speak a bit to the publicity angle, which I hope you all realize that one of the angles on this whole hackathon is providing a platform for publicity, for what we're doing for Linnea, for, kind of generating awareness. And so any aspects of this that allow publicity is something that we're continuously looking for. Gail?
Thanks very much, Brad. Yeah, we were sort of kicking around 2 angles the last week or so, and one might be a letter to the editor that we could write and position in a top tier newspaper or a second tier paper, basically specifically focused on calling attention to the issue of tissue and how important that is to ask the right questions. So that could be a letter to the editor, and from sort of framing what we're all talking about, and bringing up the issue of patient rights. And the other angle that we were thinking of is maybe profiling, the purpose of the hackathon, the importance of advocacy in treatment, maybe maybe a discussion about how to help patients navigate their own care, and maybe pitching that type of a story to either one of the, say, New York Times Be Well columns, or maybe a potential top tier reporter who covers healthcare. So more to come on that, but we'll keep you posted on how we net out with both those angles.
Thank you very much, Gail. And I just wanted to, just mention this, and then it'll go into the notes. And it's what I've found with the crowd in our community is if you make a specific request, I'm always pleasantly surprised at the responses. And so if we put something out there that says we're considering this publicity angle, does anybody know any reporters, journalists at various publications who might be interested in what we're doing here? I'm always pleasantly surprised. Like, things come out of where people that haven't spoken up on anything else, all of a sudden come to the fore. So thank you, Gail, for catalyzing that and being the foil for that aspect of one of the foundations of what we're doing in the hackathon. Okay, with that, I'm going to end I'm going to stop the recording, and